Officer Tony Rouhotas, and other members of the Imperial County team. Today, it's Tony Rouhotas and Janette Angulo from the Imperial County Health Department. First off, good morning, Tony. Good morning, Janette.
Good morning, sir.
Good morning, Carroll.
It's another beautiful day in the valley, a bit hazy with the smoke coming down from the San Diego fires, but hey, we can handle this, right?
Not a problem.
Okay. First question I've got for you, Tony. The county, as well as the cities, have sent a letter to Governor Newsom requesting that we get a break and we be able to move to the next phase of the reopening plan. Has there been any response?
So staff did have a brief discussion with the state last night to set that meeting up. We do not have a confirmed meeting, but we did stress the importance of us needing that meeting as soon as possible so that Imperial County could go over what their plan would be in the event the state is willing to have those discussions. I know Ms. Angulo here is also having a meeting with some state reps today to also express that concern and begin that discussion. The other thing I've been doing is on a regular basis, I've been hosting a meeting with city managers and city mayors on a weekly basis. And we're also trying to entertain a meeting with the state for them to be able to join me and our chairman as well to get the word out and have that discussion with the state as well. And we hope to have that meeting set up with a rep by early next week.
Okay, and based on past considerations, the folks in Sacramento are still trying to figure out whether Imperial County is part of California or Arizona.
That's always been a touchy subject, hasn't it?
Yes, it has. Janette, a couple of quick questions for you. Okay, there has been reopening of sorts for retail, and one of the things that we need to touch on is facial coverings and social distancing. They're not recommended, they are required in Imperial County, right?
Yes. Well, face coverings are required. We have a health officer order in place that if you cannot maintain at least 6 foot distance from others that are not in your household, you must wear a facial covering. That's correct. And the social distancing is highly, highly recommended.
Okay. And with the opening, we get questions, what are the responsibilities of an employer? And turn it around, what are the responsibilities of an employee to meet the requirements set forth?
That's a great question, Carol, and I've been receiving that question quite often now. And my response is it's 50-50. Responsibility is 50-50. The employer for sure has responsibility. They need to ensure that the workplace is safe, it's clean, that employees are provided with the tools, the information, the equipment necessary. But now the employee also plays a very important role. They need to, again, wear a face covering if they cannot be 6 feet apart from others. Help clean, your areas. Don't gather with others during your break, during your lunch. Try to avoid those frequently touched surfaces. Now, if you're sick, stay home. Let your employer know, I have these symptoms, and stay home. Washing your hands, and I'm all over the place with the ordering, but washing your hands is really important with soap and water, and if soap and water is not available, hand sanitizer. So just taking those measures and many other measures, that's the responsibility of the employee, because we got to remember, we go home at the end of the day, and we don't want to take the virus home. Our loved ones are waiting for us.
One of the comments I've had to people, I'm not worried about getting, the coronavirus. I'm healthy, I'm young, I can handle it. Yeah, but what about grandma? What about the kids? What about the person that has some other issues, other health issues, and
Carroll,
you've got to watch out for them.
And you bring up an excellent point, Carroll, because if you take a look at our statistics, those individuals in Imperial County, we have quite a bit of cases for individuals between, the age groups of 20 to 30, 30 to 39, 40 to 49, 50 to 59, the younger folks. And what we've seen a lot, or the comments received are, oh, we're healthy, we can handle it. But that's not the bigger issue. It's those who are higher risk that are around us. If we take a look at our death rate, it's our elderly that are passing away for the most part. We have a few younger folks that are passing away, but we really need to be conscientious about, okay, if I get infected, what does that mean for those that are around me? And, is it the older? Is it somebody with other health conditions that, their situation might worsen? And I hate to say this, it may lead to death. So we need to start sending that message. It's not just about you. You may think you're healthy and young. It's also about others that are around us.
Okay, you brought up your dashboard with your statistics. How current is that? I know it's updated daily, but how current are the numbers that are being posted?
Okay, so the numbers are as of yesterday, and if you've noticed, we changed our mechanism to update them every morning. So I'll explain a little bit about what you'll find in the dashboard and what happens on the back end, because I don't think many understand what is needed to display numbers. So, we need a system. We depend on machines, and sometimes, and I'll just touch upon what happened earlier in the week. There was an upload on June 8th, and there were some numbers, and then the following day, the total tested changed, and it actually reduced. But that had to do with a couple of discrepancies. Again, it goes back to systems. They were detected. There was data that needed to be merged from a disease reporting system. And so when our staff was made aware of that, they responded to it quickly, and we needed to correct it to what it was. And unfortunately, it was a number less than what was posted on June 8th. And that's why we came up, and said, hey, community, this is what happened. This is what's going on. These are our true numbers as of today. So that issue was corrected. Now, there's something else that's going on, and it's with the Weather Channel, I think, and then it's the state dashboard as well. They also post numbers, and the numbers are not going to match. And it makes sense because we are receiving the numbers firsthand. And the other thing is, just about a week and a half or two ago, we added some additional categories. And that's what I want to walk through, the additional categories. So very top of the numbers, you'll find the total tested. So that's 18,211. Again, that was as of yesterday. That's the overall total that we've received. The total negative cases are 14,117. Now, the cases pending investigation is just right below that. Those cases, they're under investigation, so they haven't found a home within another category, meaning we don't know if they are out-of-county cases, out-of-country cases, and if they are our residents, then they'll make their way to the total positive cases for our county. So those numbers have not been counted in total positive cases for Imperial or out of county or out of country. So we're still investigating and trying to find a home for them. So right below cases pending investigation, like I said, it's the out of county cases. So those cases live somewhere in the United States, but not in Imperial County. And then the out-of-country cases, those live either in Mexico or in any other country. The majority are from Mexico, though. And so out of county, we have 91 so far, and out of country, we have 83. Now, right below that, you'll find the total positive cases for Imperial County. So we've had 3,405. And then there's the breakdown of active, recovered, and death. So because we had a lot of questions of, well, the numbers are not adding up. Again, that's why we added the additional categories, which is the cases pending investigation, out of county, and out of country. So it's always, those numbers are always changing, always moving, because we've had quite a bit of testing going on. There's a lot of activity, Carroll.
Well, anecdotally, somebody may hear, well, I heard so-and-so died from COVID-19, but I don't see the numbers on the dashboard. Well, you don't just take the anecdotal information, you have to have it verified, right?
Correct, and we work with hospitals, coroners, and we get the death certificates. It's a whole investigation that happens. We just do not take, information, hearsay information. Oh, no, we would never do that.
And social media is not a reliable source necessarily.
Yes, that is correct.
Okay, and I want to ask you about surge beds. Your dashboard shows surge beds. Okay, what are surge beds? Where are they? Are they hidden in a closet somewhere?
No, not in closets. So surge beds are additional inpatient beds that may not be currently operational or staffed, but they're there in case they are needed. And for example, we have added additional beds outside of the hospital systems, and that is over at the Imperial Valley College, where we have that alternate care site. And the capacity is, beds set up are 80, but there's the capacity to add some more. And going back to the hospitals, they also have surge beds. And when we talk about, they're not staffed currently in Imperial County, we're receiving aid from state and federal resources. And both hospitals have received manpower from these resources, and these have included registered nurses, physicians, respiratory therapists. So we're very thankful for that assistance that's been coming down from the state and the federal government. Okay,
for a while, I mentioned I live on the flight path to El Centro Regional Medical Center. And, medevac helicopters were coming in about every 30 minutes. That appears to have slowed down significantly. Are you still moving patients out of the valley? And on the same token, I know that some patients have been moved up to the Bay Area. How do you bring them back?
Okay, so you are right. Let's about the helicopters not being as active. You are right. The surge was more around May 19th. That's when it started to increase quite a bit. From May 19th, and as of today, actually yesterday, we had close to 300 patients being transferred out of Imperial County, and of those, 80%, a little over 80% were from El Centro Regional Medical Center. And it's been about a week or so. There's been spikes here and there, but they are not like what we had mid-May or so. We work with the California All Access Transfer Center, and we coordinate the transfer of COVID positive patients. We try to keep them in the Southern California area, the Southern California hospitals. But you're right, some patients have gone as far as the Bay Area, the Sacramento area, yes. our emergency management systems agency manager and our EMS medical director, Dr. Staff. We're working with the hospitals and working with their staff so that there's a plan in place to bring those patients back. So we would coordinate, like we coordinated the transfer out. We would coordinate with the state and the locals to get those patients back into our county.
Okay, and that's a question a number of people had. Okay, you flew Uncle Louis to San Mateo. How we're going to get Uncle Louis back? So
we'll take care of Uncle Louis.
Okay, very good. Did we miss anything?
No, I think you covered it, Carroll. Just reminding the community, COVID-19 is here, and it'll probably be here to stay for a little while. So please take the needed measures, social distance yourself, wash your hands with soap and water, wear your face cover, be safe when you're out there. Look around you, like I said. Again, you may feel healthy, you may be young or feel young, but it's not just about me. It's about all of those that are around me, especially those that are higher at risk. We are all responsible, and we are all in this together, Carroll.
Okay, now one thing, and we have been trying to stress this, and this has to do with what we talked with Tony about initially. We need more negative tests. And we're trying to encourage people, get tested. It's free, it's painless, and it takes just a couple of minutes, and you can get tested at the Veterans Hall in Imperial or at the Community Center in Calexico through OptumServe, right?
That's correct, Carroll. Those are the two sites that the county has coordinated the setup of, and we do need those. And what's really important is that we continue to fill those spots, because if we continue to fill those spots, we can actually ask for additional testing to occur. So this is just really the first and second phase, but there's different additional phases. And once we meet the metrics of maintaining more than, I think it's 80% testing on a regular basis for so many days, they'll allow us to add additional lanes to actually expedite that. So it's a win-win if we get the additional people to get tested. And initially, you're right. We only wanted the ill people to be tested because the limited amount throughout California. However, now with the mass distribution of testing supplies occurring throughout the state, it's super important that we get everybody down to get tested as soon as possible. Those are the two sites that you can show up to. You can go online and register. And when you show up, there is no charge to you. They bill insurance, or it is free for those that cannot pay for it. However, there is additional sites throughout private sites or through the hospitals. There is testing that occurs there as well. So we are advocating for everybody, as many people as possible, to go out and get tested, including the people that are feeling well and have no symptoms.
If you do seek testing from a provider, we highly encourage that you ask, if they accept insurance or what the cost is, because the cost may vary from provider to provider. At the OptumServe site, like the chief said, it's at no cost.
Exactly. Okay, we appreciate the information today. A lot of good stuff for folks to think about over the weekend. And speaking of that, both of you, have a great weekend.
Carroll, one last thing. As the state moves forward, like today, there is some noticing going out about different counties being able to move to different variances. So it's really important to track the county that you reside in with the rules that follow that county. So sometimes the governor has put out press releases, and there's not enough detail into the area of discussion where it just says the different phases. So we just want to say, as the governor puts out different guidance, don't assume that's for the entire state. When it is for the entire state or allows us to move, we've been putting messaging out as soon as possible. So I just want to limit any kind of confusion as they see, because there is possibly updates going out this afternoon.
And we are currently in stage 2, low risk.
And my understanding is San Diego is opening restaurants for seating this weekend. And, just because it's open doesn't mean you should go. So we'll keep an eye on that. Again, have a great weekend, and we'll be visiting next week.
Thank you. You too.
As always, thanks, Carol. Take care.
The best oldies on the radio.
12:30.